Hi, my name is Avery. I'm going to be your practitioner for the day. What's your name?
Kendall,
Excellent. So what are you here for today, Miss Kendall?
to establish care.
Excellent, okay. So during the course of this assessment, I'm going to be doing a couple of different things. I'm going to be asking you to do a few different things. We're going to be focusing mainly on the neurological portion of an exam, okay? The first few silly questions I have to ask everybody. Can you tell me your full name and your date of birth?
Kendall Fuller, 7/17/97.
Beautiful. And what is today's date?
November 8th, 2021.
Excellent. Where are we at right now, Miss Kendall?
In your doctor's office.
That's right. So we have already established that she is alert and oriented to person, place, time, and situation. So we are going to move right along to the first portion of our assessment, which is going to be the cranial nerve assessment, okay? So the very first cranial nerve is the olfactory nerve, which is our sense of smell. I have prepared a scent for you on this little cotton pad. If you could close your eyes and take a deep breath in and just identify that scent for me.
Eucalyptus.
Beautiful. So that is once again the olfactory nerve, cranial nerve number 1. Our second cranial nerve is the optic nerve, which is our sense of vision. It's a sensory nerve. So I'm going to be doing a couple of different things. I don't have my Snellen chart with me, so I'm going to ask you to identify how many fingers I'm holding up.
2. 4. 2. 3. 4.
Beautiful. So I'm also going to take this opportunity while we're looking at the eyes to test the 3rd, 4th, and 6th cranial nerves, which are the oculomotor, the trochlear, and then the abducens. So we're going to do that by doing a couple of different things. I have my pen light here. I'm going to ask you to just keep an eye on the pen light, okay?
Okay.
So we are looking at accommodation. I'm going to flick this pen light on. Test for pupillary constriction. Perfect. And then we are going to go on to the 6 fields of gaze. So just follow my finger with just your eyes, okay? Perfect. Next, we're going to go to the 5th cranial nerve, which is the trigeminal nerve. That is going to be responsible for our chewing primarily. So I'm going to ask you to clench your jaw real tight. I'm just going to feel around. And then if I can get you to open your mouth with my resistance, perfect. So moving along to the 7th one, we are going to go for the facial nerve. So that is going to be primarily our facial expressions. So I'm going to ask you to give me a big smile and then close your eyes real tight. Perfect. Stick your tongue out for me and then give me a really big frowny face. Great. So next we're going to do the vestibulocochlear, which is the 8th cranial nerve. We're going to test this by doing a whisper test. So I'm going to cover your ear. I'm going to whisper something over here and just identify the word that I'm saying.
Banana.
Great.
Acorn.
Great. So we know that up to now, all of our cranial nerves are completely intact and functioning appropriately. The next one is going to be the glossopharyngeal, which is going to be our ah and our gag reflex. So if I get you to say ah for me. Great. And give me a nice good swallow. Perfect. Usually I would stick something in her mouth and really test that gag reflex. But you know, with COVID and everything, we're not going to do that right now. So now we're going to go for the 10th cranial nerve, which is the vagus nerve. It is going to be responsible for our talking and our mouth movements and our throat movements while we speak. I've actually already been assessing that, and it is perfectly intact. The next one we're going to do is the abducens, which is our neck and our shoulder innervator. So if I can get you to look to the left with your whole head, and the right, up and down, perfect. And if you can shrug your shoulders against my resistance. Perfect. So the next one and the final cranial nerve, number 12, is the hypoglossal nerve. So it is going to control our tongue and the muscles under our tongue. So I can get you to stick your tongue out for me, open wide, stick your tongue out, and then lift your tongue up, and then to the side, to the other side, perfect. So I can see that they are all intact and working very appropriately. So we're going to go to the next portion of the exam. So the next portion of the exam is going to be our fine motor and balance portion. So I'm going to ask you to do a couple of those silly things that we were talking about, okay? The first one is I'm going to ask you to put your finger to your nose and then touch mine. So, perfect. And then again. Perfect. So I want you to stick your hands out, close your eyes, and then touch each index finger to your nose, keeping your eyes closed. Perfect. The next thing is I'm going to test our rapid hand movement, so you can open your eyes now and just stick your hands in your lap and then alternate between palms up and palms down. Good. Perfect. So another thing we're going to test is the fine motor skills of our legs. So I'm going to get you to take the heel of one foot, go to the knee of the opposite foot, yep, and then just like that, let's go ahead and switch with the other legs. Perfect. Next, I'm going to help you down off the table. We're going to perform something called the wrong verb test. The wrong verb test. So I'm going to get you to stand with your feet very close together, and we can actually face here if you want. Perfect, perfect. So close your eyes. I'm right here with you. You're not going to fall. And then just stand there for a moment. And if you can put your hands right out in front of you now, and just stand there for a moment. You may open your eyes now and relax. I'm going to ask you to walk that way just a few feet and then walk back. So we could see from the Romberg test that her balance was very good. In addition, her gait is appropriate. Her arms aren't swinging to the side like this. She's able to walk appropriately. I'm going to get you to have another seat right here. Perfect. Okay, I have a very sharp object with me, okay? I am going to place the pinpricks on your body, and I need you to tell me where they're at, okay?
Left wrist. Right wrist. Neck.
And then just tell me when you can feel them.
Yes. Yes. Yes.
We're just going along
Yes.
the feet right now.
Yes. Yes. Yes.
Perfect. So the next thing I'm going to do is ask you to identify a sharp or a dull sensation. So this is the sharp, and this is the dull. Okay? Sharp, 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 dull, sharp, dull. Good. All right. The next thing I'm going to do is something called a 2-point test. So if you could close your eyes for me and hand, yeah, perfect. I am going to ask you to identify 1 point between 2 points, okay?
Okay. Okay. 1. 1. 1. 1. 1. 1. 1. 2. Good.
All right, so the next thing I'm going to do is I'm going to ask you to close your eyes once again and identify this object that I'm placing in your hands. It's a key. Perfect. We're going to do the other one. Key. Perfect. Now just keep your palms up toward me. I am going to do another test. I'm going to draw a letter or a number on the palms of your hand and just identify that letter or the number. A. Great.
2.
Great. Perfect. Okay, so the next thing I'm going to do is ask you to keep your hands out like this, and I'm going to ask you to tell me if I am lifting your fingers up or down.
Up. Down.
Okay, and now your feet.
Up. Down.
Good. So far we have assessed her response to pain and touch with the sharp things and deciding where they're at in life. We have tested her spatial awareness. We have tested her fine motor skills, and that is great. So we are going to continue on to our reflexes now, okay? So if I can get you to lay down on the thing. Usually I would be doing this shirtless with a patient. However, we're not going to do that right now. I am going to test her muscle reflexes on her stomach. Good, and I can see the muscle quiver even with the shirt on. I'm going to help you sit up now. Usually I would do this with a reflex hammer, but we are going to use the diaphragm of the stethoscope, so we are going to test a few different reflexes, okay? I can get you to just relax your arm for me. We're going to test the bicep, perfect. The tricep, perfect. The brachioradialis, perfect. And we're going to continue that with the other arm. So once again, the bicep, tricep, brachioradialis, perfect. Next, we're going to do the patellar of both legs, perfect. And then we are going to do the Achilles. Perfect. Next, we're going to test the plantar reflexes. Those are within expected limits. Perfect. No Babinski sign. And then, it is quite difficult to see, but I am going to test her ankle conus. So, perfect. Within expected limits, both of them. Okay, I'm going to do a couple of more things. Usually I would do this with the tuning fork, but I would vibrate the tuning fork and place it over the bony prominences to test for vibration in those. So this is me with my makeshift tuning fork. All right, Miss Kendall, how are you feeling? Good. Anything else I can do for you? Any questions that you have for me?
No, ma'am.
Excellent. So I will leave it at that, and I will see you again soon, okay?